Hello, everyone. Thank you so much for joining us for this School Health Series webinar, and welcome to this webinar for Lead the Way, Engaging Youth in Healthcare. My name is Jordan Buckley, Manager of School Health Programs with SOPHE, the Society for Public Health Education. On behalf of SOPHE, we are excited with the interest in today's webinar and so thankful that you have taken the time out of your day to participate. Before I hand it over to our speakers today, I'd like to cover some housekeeping items. First, please know that all attendees are muted for the duration of today's webinar. To interact with the speakers, please use the chat box or submit to the Q&A. After hearing from our presenters, we will have a Q&A session with the time remaining. Questions can be submitted at any time during the webinar by typing in the Q&A box. We value your feedback and ask you to complete the feedback form that will pop up in your internet browser immediately following today's webinar. Your evaluations of this program will assist us in planning future webinars. Please know that today's webinar is being recorded and will be made available on demand in SOPHE School Health playlist within 2 weeks. Please subscribe to the playlist for more information and more updates. As a quick introduction, SOPHE is a nonprofit organization founded in 1950, dedicated to providing global leadership to the profession of health education and health promotion, and to promote the health of all people. Members include health education professionals and students throughout the United States and internationally. The organization promotes healthy behaviors, healthy communities, and healthy environments through its membership, its network of local chapters, and its numerous partnerships with other organizations. Now, I am excited to introduce today's speakers. We have Selena E. Moore with the School-Based Health Alliance, and we also have Nicole Carrillo. Selena, as a Senior Program Manager, leads the Youth Safety Net Project, a HRSA-funded national cooperative agreement initiative focused on improving health equity and access through training and technical assistance for safety net providers serving school-age children and adolescents. Through the Youth Safety Net Project, Selena facilitates training opportunities for school and community health centers on a number of topics, including adolescent health, social determinants of health, enabling services, and school and health center partnerships. Selena also works with health centers to cultivate youth-led approaches to healthcare delivery and oversees the Alliance's youth development endeavors. Nicole, as Program Associate for the Alliance, supports a variety of technical assistance, training, and continuing education efforts for school and community-based health centers, and oversees the youth development initiatives of Youth Safety Net Project and the organization at large. Through the Youth Safety Net Project, Nicole is responsible for supporting initiatives focused on improving health equity and access through training and technical assistance to safety net providers and serving the school-age children and adolescents. She also helps to facilitate the Alliance's Youth Advisory Council and the Be the Change youth training program at their annual convention. Selena and Nicole, I'm so excited to hand it over to you.
Thank you so much, Jordan. We are thrilled to be here today, and thank you for all that are on this webinar as well, joining for this information. Again, the title is Lead the Way, Engaging Youth in Healthcare. And for those of you who are not familiar with the School-Based Health Alliance, we are the National School-Based Healthcare Advocacy, Technical Assistance, and Training Organization based in DC, but we have 23 state affiliates across the country, and we work to improve the health of children and youth by advocating and advancing school-based healthcare. And as youth-friendly and accessible settings, school-based health centers are uniquely positioned to deliver high-quality confidential services that equip children and adolescents with the information, tools, and supports they need to be healthy and safe where they are and when they need it, which is in schools. Also just want to say that especially now, even more so than before, given everything that's going on, it's important that we support and continue to support the health of students and recognizing that connection to their future success and their educational success, and that we believe that all children and adolescents deserve to thrive, and that when health and education come together, great things can happen, and that is very true for us, and we know is true in this partnership with SOPHE, and we're so glad to be able to share more about it from the youth development perspective today. And so you'll see here the objectives for today's webinar is to help you all identify 7 key steps and methods to starting, maintaining, and retaining youth partnerships, develop skills and mentoring capacities to engage youth as partners and elevate youth voice, and create sustainable conditions where meaningful youth leadership and development take place.
Thank you for that, Selena. So right off the bat, this is Nicole, right off the bat, we want to start off with a poll question. We just want to know, how do you feel about youth partnerships? Do we feel, we have 3 options here. Some of us are going to feel really excited about youth partnerships, so we're happy. Some of us are a little scared about them, so we might choose the frowny face. And some of us might not necessarily have any experience with youth partnerships, and so we don't exactly know how we feel about it. So, all right, we're getting more people are really excited about youth partnerships, and that's awesome, and we really love that. We have some people, we have about 11 of you that are maybe don't have as much experience, but there are still some of you that maybe you're not too happy about them, or maybe the way that they've gone in the past. So we're going to check back in later during this presentation, and we're going to see if we can move those of you that have those frowny faces, that are not excited about it, and let's see if we can move you to the happy faces about it. Our next thing that we want to do is we want to ask those of you, there were several of you that were incredibly excited, I'm assuming, since you put the little smiley face on there. Why are youth partnerships in schools important to you, your health center, or your organization? And so we're going to ask you to put this in the chat box and just go ahead and ask us. Maybe you've had a really good experience with them, and you've seen how they've been important in your organization. So go ahead and put those responses into the chat box, and let's see if we can gain some insight from your guys' experiences. All right, we have Jennifer Baker, who says that services for youth need to have youth involved. Nothing about us without us. And I love that. We, as you'll learn a little bit later, we have a youth advisory council, and that's all the time, that is what they say, right? They want to be heard, and they say nothing about us without us. Yeah, there's several of you that have said that. So we also have the ability to provide peer-driven prevention. Of course, there's nothing more powerful than a youth advocating for themselves and advocating for their friends. Of course, wow, you guys are super excited about this. Yes, want to be able to provide services that are identified, needed, and impactful for youth. Of course, we want to make sure that the services that we're offering, the conversations that we're having, are going to be meaningful and sustainable when we're working with youth, right? And if they're not interested, or they don't even want to hear it, then we need to find something else, right? We need to ask them, what do you want to learn more about? What do you want to hear about? Engagement and relationships are the foundation of collaboration, participation, and communication. Of course, we want to make sure that we're not just putting what we think is important out there. We want to go ahead and make sure and hear what they have to say to create that communication, to create those relationships. Of course, you guys can keep chatting into the chat box. I'm sure that your peers would love to hear more about why you think that it's important, but we're going to go ahead and move on. Thank you so much. We're going to have more questions and more polls coming along, and so we want to go ahead and continue to hear your voice. And so we're going to talk a little bit about why youth development matters. So we want to youth development is incredibly important, right? So youth development takes partnerships, programming, and other initiatives from just taking care of the immediate needs of the student. So talking about like drug prevention or absenteeism, and taking it to viewing the student as a whole. So yes, the student may have a drug problem, or yes, we want to make sure that that student gets to graduation day, but, and then what? Right? We want to make sure that we're taking care of the student and looking towards the future, making sure that they're building the right relationships. They're making sure to realize the importance for themselves, why they should invest in their own health care. And so we look at how it aids the school environment in creating a healthy school environment. So it's making sure that the student is satisfied, the student is happy, right? So that maybe they are not in it just for themselves, but for their families as well. So you touch one student and you touch the whole family. You touch the family, you touch the community. And that's exactly what the whole school, whole community, whole child model is about, right? You want to make sure that you realize that it's not just about one student. It's about so much more than that. And it's not just about one small goal. It's about a student's life. And so taking that into consideration, that's why we believe that youth development matters. And so going into a couple of definitions. So we have youth development. So youth development is an approach to youth programming and policy that has preparation and development as its ultimate goal, rather than prevention, deterrence, and deficit reduction. So this isn't about how we can fix them, but it's about how we can help them to grow. And so then you have youth engagement. So youth engagement is all about aligning with the mission outside of themselves and realizing that their opinions and participation holds value. So then you see that youth partnerships are, you have the adults and the youth as equal partners in these decision-making processes. And so taking into consideration, youth partnerships and youth engagement are a part of youth development. So youth development does not happen without the engagement and without those partnerships. And you'll be able to actually see that a little bit later when we go more into depth on youth development and how to actually create those youth participation models. So we have some rationale for youth engagement. So a lot of the times youth will ask, okay, but what's in it for me, right? And oftentimes we ask those same questions, right? But why should we invest in youth? Why, if we think that we can do it so well for ourselves, why do we need to even tap into them? Well, there are many reasons. For youth, we have this knowledge and awareness, right? And that's where we really want to help them, at least as health centers, is that youth become more aware of the consequences of risky and unhealthy behaviors, right? And the social determinants of health and health disparities in their communities, just making sure to provide that insight that they might not necessarily get from being on Twitter and just going to classes and being on sports teams. Involving them in their health and providing that knowledge and awareness, they can grow in that area. Also giving them experiences. Young people love to try new things, and this is definitely something that you can tap into them. Practical skills, of course, and finally self-efficacy, right? So this enables the youth to be assertive as health center clients, students, and leaders in their communities. So this doesn't just create better students, but this creates better champions for a better world. And so again, for us, right, so what do we get as adult allies? Community asset mapping and needs assessment, right? So youth are key informants for this. They can provide insight into health conditions of their environment. They might be able to provide stories of their own community, where their home is located, their community of the school, what's going on, things that you might not be aware of. Health center services, like someone mentioned earlier in the chat box, just being able to hear what they need, being able to hear what they're seeking and what they need in terms of their health. And they might be able to suggest new offerings. You know, you might be really, really focused on drug prevention, but you don't realize that, you know, there's a lot of chatter going on about STDs or something else, right? Or something else that they're a lot more concerned about. Making sure that, you know, outreach and enrollment, youth are a key resource in promoting a positive image of health centers for their peers. An image that emphasizes, you know, safety, friendliness, and trust. If one youth doesn't feel like they can trust you, or if they don't have a good experience, you can believe that they're going to tell that story to someone else, and then that person is going to tell that story to another person, and what you'll get is that your reputation or anything good that you're trying to do is going to be tainted with that. And finally, peer-to-peer health education. You can, this goes back with the knowledge and awareness piece for the youth, but with thorough preparation and culturally appropriate and medically accurate health curriculum from adult creators and allies, young people can actually be trained to educate other students and other youth on a variety of health topics and resources available to them. And we do this, for example, with our own Youth Advisory Council. They pick something that they're really passionate about. This year it's actually mental health, and so they'll pick something that they're really passionate about, and they'll go ahead and not only teach their peers about what's going on and how they can involve and how they can be advocates for their own mental health, but they also teach clinicians, providers, sponsors, and administrators on how to create programming to advocate for students as well. So it's not only to teach them about health, but it's so much more than that. And so we have these 7 key youth engagement steps. So talking about, we'll talk about youth participation models, we'll talk about recruiting and retaining young leaders, cultivating that parental support, developing youth leadership skills, youth leadership networks, cultivating community support, and promoting youth engagement efforts. And some of these, like the first 4, really do happen in a sequence, but I do want to point out that they happen oftentimes interchangeably. You might really need to be focusing on community support if you're trying to find the funding, or parental support. You might actually need to find that before you even you know, are trying to find those young leaders, because you're in a community where you need to tap into those parents first. It might look different for you, but we have decided, or we have pinpointed as the School-Based Health Alliance, these 7 key steps that need to be fulfilled in order to create and retain a sustainable youth program. So talking about these youth participation models, you have the youth-led, youth-adult partnerships, and adult-led. With the youth-led, so this is when young people are the main spokespersons, spokespeople in youth-led models, and they look to adults to provide administrative support. All right, and so youth are actually trained and supported to conduct outreach and coordinate projects with their peers. Youth-led organizations make a point to defer to the vision and authority of youth. So youth-led is very much focused on what the youth need, what the youth want, how the youth are going to get there, and how can we as adult allies help to take their vision to the next level? How do we help take them from their vision and help them to execute it as a deliverable, as an actual thing? And then you have youth adult partnerships. And so This is when youth and adults develop a common agenda, so without distinguishing youth concerns from adult concerns. And instead, youth and adults share power and authority to plan and mobilize and educate based upon defined roles, responsibilities, skills. You might have a youth that's really incredibly tech savvy, and you might want to create a campaign of some sort for your school or for your health center, and being able to partner on that and being able to use your expertise but use the expertise of the young person as well can create a very viable youth-adult partnership that can go a lot further than if you were to just try to create this campaign and advocate it for yourself. And then you have the adult-led. So in this model, the youth are actually considered core constituents, right? So they're not necessarily the ones that are involved in the planning process or even having their voices heard. They're just there to carry out the campaign strategies or project tactics that are generally developed by adults. And so youth efforts to influence the platform may be minimized in order to maintain campaign priorities. So they are actually participants instead of key decision makers. And so for some cases, this might actually be the best model, but the model that we're really focusing on today is these youth-adult partnerships and trying to get us there. Like we said, this might take a little bit of decision making, right? So there's a lot of questions that you're going to need to ask for yourself and for your health center. It's what type of decision making power will youth have? Who will be the individuals leading and facilitating? How do we get there, right? How do we decide which participation model to take for ourselves? And so here's a better description of, or here's a visual that we really like for the forms of youth participation. And so you see that there is obviously more youth participation in the youth-led, and adult-led has a lot less. And so I just really like this visual for forms of participation, forms of youth participation, And then we have Hart's ladder of participation. And this provides a visual framework for health centers to think about the current states of youth participation and actually brainstorm the ideal balance between youth and adults in decision making. So while the balance of youth and adult participation might shift over time, each increase in level of participation generates a higher degree of development for youth. So it's all about intentionality, intensity, and balance. And so the three that we really do want to steer away from are tokenism, decoration, and manipulation. No one just wants to be there, especially a youth, just to say that you had a youth there, right? They want to be involved, they want to be active. No one wants to just be a decoration. We don't want to just be a decoration. So why would we expect youth to? And no one wants to be manipulated, and youth can definitely tell when they're one of these three. So we want to steer away from those. So we have some main questions on recruitment, right? So we've decided which participation model we want to use. We've decided where we want to go. So where do we go about recruitment? How are we going to recruit, and what does this process even look like? Well, where existing clubs, look at your sports teams, look in your classrooms, look at your community events that are happening. Where are the youth at? What are they doing? Who are the youth that are coming through your doors and seeking your help? Those are the students that are going to be the best advocates for your clinic or for your health center or for your initiative, program, whatever it is, because they are the ones that are receiving the services. They are the ones that are hopefully having a great experience with it. So why wouldn't they want to just brag about it? If you're having a good relationship with them, if you created a great relationship with them, then they're going to want to help other people to get those resources and also to help make them even better. So how are you going to recruit? This is a little bit about how we recruit on for the Youth Advisory Council, the national one. We use social media. This is an actual social media post that we have made in calling for youth to come and be a part of our council. We also have a digest that we promote on or we recruit on, and there are a lot of other organizations that have digests. And so you might even have for your school a school newspaper. Your school might have a Twitter account or a Facebook account. They might have a parent newsletter that goes home every month or every 2 weeks or quarterly. Just making sure that you tap into those resources that are already existing, and because that way you don't have to recreate something, right? You don't have to go above and beyond. All you have to do is write up a quick blurb and just go ahead and send it out that way. Also, classroom presentations, tapping into those health teachers, those home ec teachers, the ones that you can tell that are really invested in their students are going to want the best opportunities for them. And so then what will this recruitment look like? Well, do you have an application process? And these are all questions that you should, that you're going to need to ask yourself is, and after the application process is done, are we going to hold interviews? Is this everyone who wants to be on can be on? Are we going to put a grade limit on it? Do we need to have a certain GPA? And what happens after they're accepted? What are the next steps for them to take? And so this will look different for everybody. And for some, it might make sense to just have everyone involved that wants to be involved. The more the merrier. And for some, you really can't have that, and you just need, 3 really solid youth, and you're going to have a pretty strict process of we want an application, GPA requirements. We want to make sure that there's an interview process in which we can really get to know the person and make sure that they're a good fit for what we're trying to do. And so just making sure that what happens is the best for your community and for your program. And this happens just with asking a bunch of questions and just having a conversation with all of those involved and really just seeing what is our goal. So then what are the results? Well, a council can range from 2 people, or the amount of youth that are engaged can be from 2 people to we have 8 people, and this has been the story of the School-Based Health Alliance and their council. So 2015 was actually a year that I was on the School-Based Health Alliance's Youth Advisory Council, and there were only 2 of us. And we started out with 5, and for some reason 3 dropped off, and so it was 2, and we did all of the work that needed to be done. This year, we actually have we started out with 8, and now we have 7 Youth Advisory Council members, and they're doing a fantastic job doing the same amount of work and just really being engaged and just getting to hear 8 different perspectives, because they're all from around the country. And so it really can range. There's not one definitive way of having youth engagement or what it even looks like. So retention guidelines. So making sure that you establish expectations, you provide those incentives, you meet and communicate consistently and cultivate connections and relationships. And these are almost exactly what our keys to sustainability are. And the reason that this is because you build those relationships and you have that consistency that the youth crave, and they're going to want to remain involved. They're going to want to participate and share their voice because they feel valued and they feel welcome. And so here you have elevating youth voice, right? So we want to make sure that we're making room for the youth. And then also a really important thing to do is just to make sure that you are also taking into account your own biases, your own experiences, your own just thoughts towards this, and making sure that you're elevating the youth perspective as well. So as much as you have your own biases, youth also have those. And so really just working towards trying to create those partnerships with them, really being open and honest with them. Don't be really thankful for that. They crave that honesty and that openness, and if you can have a conversation about that, they'll feel more willing to actually share their opinions and really just respect you as well. And obviously, we want to make it fun. We want to make sure that this is a really good experience for them. And sometimes we forget that they're young, and we just see them as these key stakeholders. But they're young. They're craving those fun, awesome experiences. And if we don't make if we don't make it fun, then or an enjoyable experience, they're not going to want to participate. They have a lot of other things that are more fun, that are offering knowledge and awareness and engagement, but they're also offering that enjoyable portion. And so we want to make sure that we are a good balance for that. And so what are some of the best practices for youth leadership? We actually asked some people in the field, and these are the responses that we got. Put the young people you work with in front of the leaders in organizations and legislatures. Of course, they're huge, they're powerful. Their voices, when they speak, people listen. And so wanting to make sure that we give them those opportunities that they might not have otherwise. They're equal coworkers, of course, making sure, again, striving for those those youth and adult partnerships. Training adult staff, we have found that is an incredible need that is in our field. Selena and I often get requests for, how exactly do we do this? And, you can have years in public health, or working for a health center or whatever it may be, but youth are constantly changing. The experiences that they have, the tools that they have at their fingertips, their cell phones, this wasn't a thing 20 years ago. So how do we adapt to that? And just making sure that you're training your adult staff on how to be great adult allies. And it's very simple, and but again, it's incredibly important. So here we have some keys to maintain engagement, and these are the last 4 steps on our 7 steps. And so just wanting to go ahead and touch on them. These are incredibly important. And if you want to know more about these, if you go on the School-Based Health Alliance's website, we actually have a youth engagement toolkit. All of this information was actually pulled from that toolkit, and that's a resource available to everybody. And so these are actually incredibly vital steps. You can find those in more detail on our website and our toolkit. But just for sake of time, we're actually just going to keep going, not to say that these are not as important as the retention and recruitment of young people.
And so as we continue on from the great information that Nicole shared about, recruiting and maintaining your youth adult partnerships and having youth voice integral to your work, and it was so great to hear from everyone why it's important to you. This doesn't, as she said, happen one time. It's very cyclical. Sometimes you go back to the recruitment process. Sometimes you go back to, what makes sense for retaining. As Nicole mentioned, all youth are not the same. They're not a monolith. As your group changes, then the dynamics change. What's important to them changes, and adapting with that. And so that also requires, as youth partners and adult allies, that we have to continue to build our skills and mentoring capacities, because thinking about it from a youth development perspective, it really is important to remember that regardless of what our jobs are or responsibilities, that we are all youth workers. And so if you think about it from that lens, regardless of your position that you are working on behalf of youth, be it as a health provider, as an education professional, support staff, national level, state level, local level, that we're all working for the benefit of our youth and not just for the sake of having a council to have a council or to run a campaign for just to run a campaign or only to reduce teen pregnancy or only to improve seat time and graduation rates, but ultimately what is the larger aims for their lives and how can we support them in that? How can we be mentors to them in that work? And as mentioned before in some insights that we gathered from our field around this, there were several roles throughout different organizations, all of them working at different levels with their orgs that were engaged directly in the youth development work, in working with their youth, whether it's a council or a program or supporting those in the schools or the health centers that were working with youth. Everyone from a project coordinator all the way to the chief operations officer had a stake and saw what their role was in working on behalf of youth voice and elevating them and supporting them regardless of role. And in thinking about their roles as a youth worker, not just your title, but your role as a youth worker, there is a lot in terms of the mindset that you have, and many of you mentioned this in the earlier poll about why, engaging youth is important to you, because they are the primary stakeholder, and young people can do real work. Yes, they may be young, and so you have to meet them where they are, but they have so many assets that are so rich and as valuable as the assets that we see in of ourselves that they have to bring to the table, and they can engage in the real work that we do every day and make it better. As I saw mentioned in the chat, which I thought was so great, that we are wasting time, money, and energy if we're not partnering with them. And if we're not making the space and meaningfully engaging them, we're really not utilizing all of our resources to the best effect for them. And it's also in terms of the assets, we all know that as important as this work is, it does not happen outside of opportunities and resources to really make it happen. And it's not the first or second or sometimes the third thing that's thought about in terms of what resources, money, time for staff that's needed. But in order to do it well, you need to have dedicated staff member or members who share in it together to make it happen. Or when I first joined the Alliance 5 years ago, it was myself who was the sole person working on all of our youth development work, and then in conjunction with another staff member who we were a tag team in terms of my role in direct support of the youth, her role in supporting me in that and helping other staff to understand the importance. And then that grew, and now we have Nicole, who is full-time staff with us, and continuing to talk with other members of our team about how it plays out that you too, whether you're in research and evaluation, whether you're in policy, whether you're in the communications team, where and what is your role as a youth worker in supporting youth, in supporting this work. And it does take that buy-in and commitment from leadership. Having our president before and our current one saying, yes, we get why this matters and that we need to invest in it, educationally, training-wise, financially, makes a huge difference. And then in thinking about how your leadership is facilitated, Nicole shared about, what do you think about recruiting? How do you recruit? What the process would look like? And then in terms of that continued, whether it's a program, a council, a campaign, maybe you're inviting them in for a meeting, you want their input, you want to, have them to survey, to provide you feedback on something. How does it get facilitated again, going back to sometimes it's one sole person, sometimes the responsibilities will be shared amongst multiple people. And so you see here from our field, it happened in a lot of different ways, how youth leadership, who does it, as well as how it takes place. For some, it was via having a board, or youth advisory council. For others, it was actually hiring youth as staff for different projects or as contractors for roles. One even mentioned that it takes place for them, that their catalyst for fostering youth leadership is actually during a convening, which is Be the Change, which is actually our youth training program that the Alliance puts on every year at our national convention. So it can take place in a number of ways. So now we'd like to hear again from you all. Does your health center, school, or organization provide any of the following youth development opportunities? And the poll is going to open up related to that. Do you have a youth advisory council? Are youth represented on a committee or an advisory board, either with the school or the health center or your community org? Do you have youth providing feedback on services and experiences? Are they doing peer education, like Nicole mentioned earlier? Do you have a health career pathway in place or where students can shadow? Are you doing any advocacy with them or any other type of youth development opportunity that's taking place? Seems like a little bit of everything across the board, which is great. About 57%. It's still moving around. But right now there's a tie between having youth representation on a committee as well as having peer education, mentoring, or counseling. This is really great. Quite a few of you also have a youth advisory council. And for anyone who'd like to share in the chat that if you chose other, we'd love to know what the other type of youth development opportunity is that you have taking place. So feel free to chat in what that is. But this is great to see taking place in a variety of ways. And so one of the ways that several of the ways, actually, I should say, that youth development takes place here at the School-Based Health Alliance is through, as was mentioned before, and we're going to talk a little bit more in depth about, is our Youth Advisory Council. It also takes place through Be the Change, our youth training program that is open to all high school students, and it's provided annually at the National School-Based Healthcare Convention, where it's essentially a convention within a convention, all the same workshops and networking and leadership opportunities that many of us go to at any given time of the year also takes place for youth who care about youth development themselves. They care about leadership. They care about the health of themselves and their peers and their community, and they want to be able to connect with other youth who have similar interests to them. That is an opportunity for them to do that, as well as develop their skills more, learn about ways that they can take new ideas back to their communities. And so that's a time where that takes place. We also, our council has their own social media presence and are very active in it. I would say that sometimes they're even more active than we are as an alliance. So we definitely are thrilled from that standpoint of them being so connected in that way that they maintain a very great social media presence on a number of different issues of interest to them, as well as just promoting the different work, whether it's blogs or information that they have. And then also, as was mentioned before, the Youth Engagement Toolkit that we have available for anyone to access that can provide more information and kind of leads into a lot of the different consulting that we do with whether it's health centers, other national organizations, schools, school districts, individual professionals and staff on how to increase their youth engagement and their youth development at whatever stage they're in right now, and how to improve it or start it. And so to talk a little bit more about our Youth Advisory Council, Nicole shared some of the real ways that we have done our recruitment and how they've expanded. This here just shows you a breakdown of all the different things that they're engaged in. And sometimes it's even a surprise as we share it and reminding even our own staff, like, yes, you say Youth Advisory Council, but what does that mean? And all the different things that they are engaged in. We develop the youth training program is developed by them and with them. They are the ones who are hosting a lot of the workshops themselves. They're the ones that during the process for abstracts coming in, they review the abstracts and to determine whether they feel that the content that's being submitted really would resonate with youth, and if not, how to amend it or, reject it. They blog every month. There's a new blog that's come out from our council, and so you can definitely read any of those are available on our website. They do trainings both virtually and in person. Last Friday was actually their webinar for this year. As was mentioned before, they choose a topic themselves each year that they want to focus on, and this year was mental health, but specifically stigma around mental health. And so that webinar took place. For any of you who are on with that, it was great to have you back with us today. And if you weren't, I'm going to put it actually into the chat, and we'll include it again. That's the direct link where you can find their webinar from last week. You can view previous webinars. They also foster connections with other youth in their own cities and states, and they represent 8 states right now, but also connecting with those across other states to share information. And so there's just so many different things that they're engaged in, and I know for many of you who have youth advisory councils, some of this is very similar to you and familiar, but just thinking there's so many different ways that they engage. And one in particular that is going to connect with our next slide that I want to also focus in on that we don't always think about as much is there's a connection of, having a youth advisory council or engaging in youth in some type of way that you're bringing them together, whether it's, was during the lunch period and they came to you, or it was an after-school program, and having things that are meant for them to be developed, that specific training style, which we have that as well, and our meetings had particular foci, or it's something where they're engaged with you, providing input, providing feedback that allows to also highlight your work better. Because I also saw in the chat, which I thought was really great, was that having youth partnerships in this way helps us where we need to push the curve, whether it be academic, SEL, safety related, or extracurriculars. And that's so true that you don't know what you don't know. And if we're saying that youth are our primary stakeholders and they are the ones that we're working on behalf of, then how could we not have them engaged? And not only we're over here running this grant or this project, or you've been told to, start this program with the school or create this resource that is in any way about youth, but if they're not at the table, and not just one, but genuinely at the table and throughout your process working with you to determine, is what you wrote in that proposal, does that even make sense? You're putting out this information, but, we wouldn't really say it that way. If you're not taking those into account, you don't know where you think that, we're doing what we should be doing. Yes, it's going up. Our academics are good. But then there's consistently maybe that group that's falling through the cracks. Have you spoken with them? Have you truly engaged them? So it's so important to have them inform the work that we are doing. And a lot of that for us gets informed by the 3 I's. This is a youth development principle that we follow a lot, that the youth outcomes, which are determined by the youth themselves in terms of what they see for their lives, what they want to achieve, from an intention standpoint, why does this program, so whether it's our Youth Advisory Council, whether it's the youth training program, whether it's, doing a workshop here or there, why does this matter? What are the goals of it? And do they align? Why this program? What are the program goals? And what are the supports for this goal? And are they shared with the youth that we're working with? Our Youth Advisory Council and a lot of our youth development work is made possible by a grant that we have with the Bureau for Primary Health Care. And it took us in the proposal stage writing in and explaining how we're connecting having a youth advisory council and supporting them being able to have trainings and convening in this way. What does any of that have to do with their goal, which was increasing access to care for children and adolescents? And so it was our job to make that connection to say, yes, it matters that you have, a friendly health center environment, a welcoming space, providers and staff that care about youth and are engaging them in this way for them to even want to come, receive services, come again, increase utilization, thus increasing access to care, and then working with the youth that are a part of our council and that we meet at these different conventions for them to be the ones to tell us, okay, we wrote making that connection of in general how this can happen, but you're going to be the ones who are really going to tell us how this is going to get done. So it wasn't for us to prescribe, okay, you need to write a blog every month and you need to do this health training to the field and you guys need to go out and read this and advocate on this behalf. No, that wasn't for us to say because that might not have been what they wanted to do. It was here's the connections we need to make from a program perspective. Now, how do you see this playing out? And it was different across states. They come together to do things nationally, but what they do in their own states, in their own schools and communities, is very tailored to their own needs. And that's the most important part of all of this, is that the intentions are aligned, that the interactions we have are goal-oriented, they're respectful, just as Nicole mentioned about everyone has their own preconceived notions and ideas, making sure that they can align and that there's time for that mentoring side as well as the instructional side. And then the intensity. For us, we started back a few years ago when I took over the council, they were meeting monthly. By the end of the term, they told us that, it was great. We liked being a part of the council. It was nice. But meeting monthly did not align with all the things that they wanted to do and wanted to get done, that was too much time in between for them to really connect with each other and to really achieve the goals that they had. And so it's like, well, how often then would you like to meet? Not telling them that, okay, well now we're going to meet this often, but asking them, how often would you like to meet? And then that turned into being twice a month. And now we're at the point where it's biweekly, and our term runs also along with the school year time, because before it was starting calendar year at the beginning in January. But that doesn't make sense for young people with school and other activities when everything started back in August and September, and now you're asking them to fit something in halfway through the school year. So now we made sure it started in June with them being able to come together in person at our convention, having their summer off, and then starting in August, running from an August to June cycle. So it's all about ensuring that the intensity, the interactions, and your intentions are all aligned with the outcomes that you want for themselves. And with that, that is what's led us to, based on that intention, intensity, and interaction, how our youth-informed initiatives play out here at the Alliance. And this grid just shows you all the different ways that even within our council, they're connected with us, they're receiving the trainings and and opportunities that they want to be able to learn about, whether it's school-based health or learning specifically about the communication of, health communication, or maybe it's advocacy. They're represented when we have our convention and going on Hill visits, meeting with our board, social media, but also internship opportunities are available. And by internships, we even mean making sure that there are those resources for them to receive a monetary stipend for their contributions. They don't come in knowing that, but it's something that, looking at how much time they're giving throughout the year and the time that they're dedicating, in the same way that none of us, are working for free, or maybe are provided something. And if we were in person, then maybe during our meetings we'd be providing food to also incentivize for their time, or providing maybe, Metro card if they're after school and needing to get home. Everything we do is virtual because they're spread out everywhere, and thus, how do we compensate for their time beyond providing this opportunity? We also make sure that we show them that we care and that we're thankful for their sacrifices by also providing a stipend. And so this is just something to consider and also think about, in all the different ways that, even in our grant writing process, funding, they're part of those conversations. We just closed out submitting a couple grants last week, and during a council meeting, we've gone to them and shown them the proposal, or shown what we're drafting, and say, what do you think, before it's submitted to funders. So there's so many different ways that youth can be engaged, but it's about making sure that it's continuous. Even if it is going to be a one-time, where you wanted to have an event, it only happens once a year, or you want to survey them, knowing that that's what the intentions are going in is going to make it genuine for you. What we don't want to do is give them an opportunity once and then they don't hear back what happened from that. It's like, oh, well, I did your survey, but I heard nothing else since. Oh, well, what did happen with that grant? We haven't heard anything. So just making sure that all intentions are known up front is going to ensure that it's a genuine process for youth, and so they know what the expectations are for their time.
Yeah, and so with that, we just want to make sure that we touch on how to create sustainable conditions. And as I mentioned before, our keys to sustainability are very similar to how to retain young people. And so the establishment of a safe space, consistency, trying to find that funding, and as Selena mentioned in the previous slide, just these growth opportunities on how to be able to offer maybe internships, or if you can't offer them next steps, then connecting them with organizations that can, if they want to, helping them, pick a college that will help them to, make their dreams and their visions and the stuff that they have worked for just really have a good purpose and use that. And also the importance of building relationships is incredibly, incredibly, incredibly important, and just being able to have them realize that you are their ally, that you really do care what happens with them beyond beyond council meetings or beyond their wellness visit, that they know that you are there. And touching on consistency really quick, just as much as you crave consistency, they also crave consistency. They want to know exactly when you're available, and if you say that you're available, then make sure that you are, and make sure that you're there when you say that you will be. Really quickly talking about funding, I know that Selena mentioned it already, but we are funded by a grant, but we know that some might not have the same opportunity, and so there are other ways to fund your your projects. And so just making sure that you find it, because it's incredibly important in order to, combat all of these expenses that you might have, like transportations and your meeting and food and other things that you might need, and to pay for your staff and, pay stipends or whatever that would be. It's incredibly important. It's also incredibly difficult, and we know that this might be one of the hardest things that you do as an organization, but it's incredibly it's needed. And just talking to other organizations that have already done it, whether it be the School-Based Health Alliance or other organizations that that have really strong youth partnership programs, just making sure that you tap into those and ask them for their advice as well. So there are 3 questions that we really just want you guys to ask yourself whenever creating a program that is for youth. It's, where is the youth development, and where are the youth in this? Where are they in this project, and this initiative, this grant, this meeting, and conversation? Are they sitting at the table? And if they are we giving them time to speak? Are they the ones leading the meeting? What's happening there? What levels of youth development are possible and mutually beneficial? And how much funding can we allot? Talking about this previous slide, to match the interactions, intentionality, and intensity of the youth development desired. How are all of these key steps, these necessary parts of youth engagement coming together to really just be successful? And so we have a quick question, if you would like to put it in the chat box. Of all the keys to sustainability, which of these are the greatest barrier for your organization? Or if there are multiple, what are they? We have consistency, funding, growth opportunities. Trying to build those relationships is really difficult, or establishment of a safe space. And I know it takes a little bit of a minute on my end to be able to see all of the chat. And so we're just, please keep answering this question if you haven't already. But on the flip side, what are some of your greatest strengths for your organization that have really gone well for you? What have you done that can really help, or that has really helped your project in the past? Okay, so we have school and administration and politics. Yeah, that is a big one for a lot of people, all this red tape that you have to cross. 100%. I know that, at least in my experience, tapping into the principal very first thing and just making sure that he was really involved in the entire process was incredibly helpful in just making sure that we eliminated a lot of that. I know that that's not possible for a lot of organizations, but like Selena said, we have tapped into the president of our organization, and he's incredibly excited, and the previous president was as well, to engage youth for sure. Strengths, consistency, funding, and relationships. That's awesome. It's a great problem to have too much funding, right? So where do we put all this money? I know that a lot of you might not have that problem, but it's great. That's great. For sure, these are great. Please keep answering in the chat box, and just we do have to move on for sake of time, but these are great. These are great. Thank you.
And just as all of you were putting in the chat box about, whether it's the strengths for you or, these are areas to work on, some definite keys to sustainability from the youth perspective are always the supports, opportunities, and services. So just remembering that, the supports are what you do with youth. That is how your program or your campaign or the meetings you have with them, how those run, the relationships that were mentioned that you build, those expectations that are set from the beginning. The opportunities are what's done by youth. So if they are the ones leading it, thinking back to that youth partnerships and the youth-led versus partnerships versus adult-led, if it's being done by the youth, then that's an opportunity where they're able to explore, learn, and grow. And then in terms of services, that's just the provisions that you provide so that those opportunities can take place. So do we need a meeting space, or do we need to set up for us as virtual? We need to make sure that we have the Zoom ready. Does everyone have camera capability? Getting them to convention, there's travel to think about, there's flights to be booked, getting hotel rooms, is it food for the meeting? All of those things are the services that help to make sure that those opportunities can take place. And so just lastly, now wanting to check, how do you feel about youth partnerships? So the last poll of today, and thank you all for hanging in there with us as we've gone over time, and thank you, Jordan and Sophie, for being so open to us. Last poll, how do you feel about youth partnerships now? So are you still feeling frowny face? Maybe are you neutral now? Or are you smiley face? We're seeing some really great smiley faces. Awesome. I'm always believe in ending on a high note. So smiley and neutrals are good for me. Thank you all so, so much. And with that, that is all we have for today. Yes, we are definitely open for any questions. And again, thank you. And this is how you can reach Nicole and I.
Well, thank you so much, both Nicole and Selena. We are so excited to just continue talking about all of these resources that are available to educators and school health professionals, and looking at all these different roles that we all play. We talked about the fact that we are all working with youth and for youth, and how we can really define that. And if you do have any more questions as we continue to have this conversation, or as we're wrapping up, just submit that, or even we'll look at opportunities to connect with you further, whether it's with SOPHE or with the School-Based Health Alliance, and with the work that we continue to do. That is always something that we want to continue looking at. And as we have looked at this School Health Series webinar, the focus of the webinar today was Lead the Way, Engaging Youth in Healthcare. And we were hoping to see how we can look at developing youth and what that really looks like. And that might be something where we can look at all these different focuses of engaging and developing youth and really elevating youth voice. And that was really the inspiration that we were talking about with Nicole and Selena. And so using all these resources that the Alliance has, and also that SOPHE might have, could be something that you could put into your own toolkit. And so another resource that we would want to share with you would be items that we have on the SOPHE School Health page that can really work and complement as you move forward. And so we have WISC team training modules, social emotional learning resources, WISC fact sheets, so that is the whole school, whole community, whole child, SOPHE journal, so that is evidence-based research and peer-reviewed journals, and the SOPHE School Health playlist that will be the archived and on-demand resources that you can watch at any time or share with anyone. And so again, looking at this basis for youth voice, if you want to have a fact sheet, that is something that you can really have on yourself or in your pocket. The evidence of youth voice and why that is important can be something that, again, with the work of the Alliance, we know that youth are the experts of their own experiences and essential to making decisions about wellness policy planning and programs that really work. So we have this fact sheet that goes into how we engage youth in their youth voice. How do you make room for youth? How is it practical to obtain youth input? Again, are youth involved in the work that you are doing, and why have you involved youth, or are they just there on your school health team? Or how do you make their youth voice meaningful, and do they even know the priorities of why they're involved? And it really goes into information like that, just like these steps that Nicole and Selena have really gone into, and it can really go into success stories as well. And so we hope to continue doing this type of work and go into more resources and webinars as well. You can learn more about CDC Healthy Schools, sign up for SOPHE School Health Updates, and find more SOPHE webinars. Again, this has supported this webinar today with our work with the cooperative agreement. Thank you again for joining SOPHE today's presentation, and an additional thank you to our presenters today, Nicole and Selena from the School-Based Health Alliance. If you would like to learn more about SOPHE, or if you would like to get in touch with our presenters today, please email education@sophe.org. Additionally, please know that today's webinar was being recorded and will be available on the School Health playlist within 2 weeks. Please take a moment to complete the brief feedback form that will pop up in your internet browser following the webinar. Thank you. This ends our session today.